Hello everyone, my name is Sergio Munir and I'm a sophomore attending West Broward High School. Here's my candidate number, which is 7255 as a reference. Today we'll talk about how can the government provide enough resources for mental health. Now let's delve into the perspective I'm aiming for, which is policy. Here are the list of objectives. Global problems that have shown issues regarding lack of mental health services. Find solutions how there can be ways of the government to handle these services with better policies. First off, let's navigate the global relevance. Globally, there has been a major treatment gap in mental health services, with 70% lacking access to services, which was stated by Law Von Donny, which is a global goal ambassador for the United Nations. The source of the evidence is well credible, since it is well reviewed as a broadcast that assesses global issues around the world. Overall, the number of mental health professionals have shown to be less, and while 60% of the policies acknowledge the need for funding, only a few implemented equal funding between mental and physical health services, and this has led some countries not providing effective policies, which was stated by the Pub Medical Central, which is a credible source that is developed and maintained by the National Center for Biotechnology at the U.S. National Library of Medicine, which is located at the National Institute of Health to improve health both globally and personally. Now, if you look closely at the data chart that was studied by the IHME Global Burden of Disease, which is a comprehensive effort that is known for its credibility to quantify health loss worldwide, the data chart was collected in 2021 to share the population with mental health disorders around the world. Out of all the countries that were surveyed, the United States of America has stated to have one of the highest out of the countries, with the 18% of the population. And some countries in the middle are averaging a range between 10 to 14% of the population. And some countries are not having no data or any statistic upon mental health disorders. Moving on, the United States of America has stated to have one of the highest. It has stated to have a decline. If you take a glance at this data chart that was created by the Substance Abuse and Mental Health Administration, which is known to be popular for addressing health topics and was designed by Congress in 1982, which was published in 2020 by the WhiteHouse.gov, which is also a credible source since it organizes government systems in the United States of America, it asked 5 reasons of why people were not receiving mental health services in the past year, and 45% claimed that they could not afford cost. They didn't know where to go for services, concerns about being committed or having to take medicine, and other factors such as they couldn't handle without treatment. Another survey that correlates to the survey here was conducted in 2018, which was on October 10, 2018, which was a study conducted by the National Council Cohen's Veteran Network, which is a national not-for-profit philanthropic organization and National Council for Well-Being. This way back study showed the America's current state and what America has been facing with their main problems on their basic care of mental health. The survey was conducted online with 5,000 participants and was given as a third party with 4 options. And when the survey was conducted, it claimed that 42% claimed that there was an issue on the high cost and 25% considering other necessities, limited options and long waits, where more than 90 million people had to wait, and lack of awareness, where 29% received no guidance since they didn't know where to go and didn't get much services upon their mental health care. And 21% face uncontrollable barriers, 31% felt like they will be judged, and 21% lied about their issues due to the social stigmas. Furthermore, India has also shown to be a struggle in response of demand for mental health services. According to the WHO, since 2016, 10 to 13% of India's population live with a mental health condition, yet 76 to 85% of those have reported not having support services at all. India barely has less than one psychologist to treat 100,000 people for services and only zero point 0.3 to serve 100,000. According to the Cosmos Institute of Mental Health, which is a well-known psychiatric hospital in India that conducted a survey in 2016, the survey covered 10,000 individuals in rural areas and 150 districts. The most fascinating things that were found from this study was accounted that 59% reported a lack of any de-addiction services, 57% were not aware of anyone with the mental health services, 80% had no health insurances and lacked services. This shows that India has an improper care of mental health insurances and policy efforts. Now let's shift towards the African countries. The reason why I shifted towards the area of the continent was that it's been known for its high treatment gaps in many issues of their mental health policies. Countries like Ghana and South Sudan has known to have weak policies and little to no help towards mental health services. Ghana has stated to have a 98% treatment gap of adequate services out of 2.8 million. South Sudan has noted to have a 99% of a treatment gap of services for mental health. As stated, Ghana has a high rate of treatment gap towards mental health. This has shown to be proven as data for the study was collected from the WHO AIMS report on mental health systems in Ghana, which was published by the Ministry of Health in collaboration with the WHO offices, which provided a comprehensive analysis of the country's mental health framework. The source was from the WHO Regional Office for Africa that made research assistants visit various health facilities, including regional and district hospitals, to assess the mental health facilities around Ghana. From the data that they collected, they found out that there was a lack of mental health doctors in clinics, and there was many trainees that have tended to not refresh the teachings, as you can see from the chart, where there are low rates of psychiatrists and psychologists and mental health facilitators. And another thing that they notice is that the average number of staff per bed has shown to be limited and averaged with the community-based psychiatric inpatient units. And as you can see, Ghana has been stated from the WHO to have limited human resources. So on to my solution. The way the government can fix these global issues is by taking these necessary steps on having mental health as a main priority towards the primary health system. The solution was also recognized by a doctor named Tedros Adhanom, which is an elected WHO director general that modifies assistance towards the World Health Organization. In 2020, he came up with a global target 2.3, which is one of the solutions that supports of having 80% of the countries integrate mental health into primary health care by 2030, since integration of mental health care is important towards ensuring universal health coverage. Here are some examples of the solution being a success. In Florida, the Florida Department of Government instituted a policy named the Florida Pediatric Mental Health Collaborative, which has established regional behavioral health hubs. In 2023, the Department of Health received a $2 million federal grant for the Florida Pediatric Mental Health Collaborative to integrate behavioral health services directly into pediatric primary care settings across the state. During the 2024 legislative session, the Florida legislature provided $8.26 million, making Florida the national leader for well-being. And following to Florida, the United States has also strived to improve health services, such as working with the Health of Human Services, which is a U.S. department works with federal agencies and with territorial governments around the state. The organization has invested over $400 million on providing a new suicide hotline known as the 988. And they also opened the first ever Office of Recovery at the Substance Abuse and Health Administration, which implemented more focus on policies and programs. Furthermore, the president signed the Bipartisan Protection Act, which allocated $135 million over 3 years to train healthcare providers in suicide prevention and behavioral health. Furthermore, if you look at another success country, which is known to be Sweden, since it has one of the better public healthcare systems that prioritize mental health and other primary health settings, which was stated by the European Observatory System. Upon that, the government of Sweden introduced a new plan in 2016 to 2020 to respond on focusing on bridging the gap on current mental health services. This has shown to be an impact since a data that was collected on the Mental Health Atlas 2020, which was conducted by Brian's Health and Substance Use Organization, it has stated that Sweden has shown vast improvement from 2014 to 2020, with workers and output of research has increased over time, and insurance has known to be fully covered. In addition, if you compare Sweden to the United States of America, it has been stated that Sweden has almost double the number of psychiatrists than the U.S., which was stated by the University of Nebraska-Lincoln, which had an author that is an undergraduate named Michelle Dehem that has a Bachelor's of Art in Psychology, Pre-Medicine, and College of Arts and Sciences. To conclude, we have seen many countries that are in demand of mental health services. To answer the question on how can the government provide resources can be branched into a wide debate. There are various solutions, but it's best if we grab the attention of our government to provide mental health services due to their importance and attention. Here are my sources.